We have decided to focus on the water crisis in rural communities in Nicaragua, where my family is from. All the information we have received have been from one of my cousins that is concerned about the crisis of water access in this area. She suffered from this lack of water, and according to WaterAid.org, the water crisis in Nicaragua happens in the rural areas of the central Nicaragua and the Atlantic area. Paso Hondo is a rural community in the department of Esteli in the northern Nicaragua. Previous water projects had benefited 171 families from Paso Hondo and its surrounding areas like La Calera and Cerro Grande. These previous projects studied the area where wells can be drilled, and Paso Hondo was the appropriate area to do it. During the dry season, this is where water is scarce, leaving communities suffering from not having water to cook, wash their clothes, and bath. During the rainy season, these communities like Calera and Cerro Grande didn't have access to the well located in Paso Hondo due to the rise of the river. Although communities can easily obtain water during the rainy season, they do not have a proper water purification system. This is a picture of me riding a horse crossing the river during the dry season. This is the river that divided La Calera and Cerro Grande from Paso Hondo. As you can see, there's this river stones. You can easily cross it during the dry season. And the next picture, you can see the river overflowing. That makes really hard for people to cross the river, get access to the water and the wells in Paso Hondo, and access to food and other necessities. Nicaragua, his government have not created any plan to solve the water crisis that exists in the country. Since 2018, there have been protests against the government. Now the government is called to be a dictatorship. And this makes it very difficult for international organizations to help communities as a profound step. All this protest and lack of employment have caused many Nicaragua to leave the country and leave their families behind. Nicaragua is one of the poorest countries in Central America, plus the political and economic crisis leave people without a way out and without ways to prevent disease due to poor access to clean water. In these pictures that my cousin sent to me, we can see the little water they have to wash their clothes, and you can see how they already wash, and you can see how the water get contaminated by the detergent and the soap they use. According to WaterAid.org, 1 in 3 people live below the poverty line. This means less than $1 a day, and this is a total of 1.8 million people in Nicaragua. The most affected by disease such as diarrhea are children 6 years and below. They don't have a very good health system, so this makes very hard for those people to avoid disease and get the proper treatment. Now with the COVID-19, the elderly people are at risk in this area due to the most effective way to prevent being infected by the COVID-19 is to wash your hands. These communities without water are full of great fear for what could happen. The government have not taken all the recommendations to avoid the virus in all the population. So people that are responsible for their own health, and they are in isolation, all the people that can, but people that live day by day, they can do that. And these people that wash their clothes in the river, so they get together as a group. So there is a greater concern about the population and the lack of water.
Drilling a new well in Paso Hondo, Nicaragua. The problem faced in Paso Hondo, Nicaragua is accessing clean, reliable water year-round. Previous attempts with digging shallow wells has resulted in a dried up well that fails. We will drill a 300-foot well that accesses a previously identified aquifer that is capable of producing clean water year-round. This well will have an electric pump that will supply large sums of water for all 3 small villages in the area. 2 individuals will be chosen from each of 3 villages to become licensed and certified to maintain the new well through hands-on training and a series of tests. They will be given all the tools necessary to repair and maintain the well and do all required annual testing of the water. They will perform preventative maintenance, such as flow tests to determine system output, inspect well equipment to ensure it is sanitary, test for coliform bacteria and nitrates, and check the well covers or well caps on top of the well casing to make sure it is in good condition. Lastly, keeping a written report of results from periodic maintenance. These individuals will then be given catalogs with part numbers for ordering replacement parts, as well as listed websites where parts can be ordered. After the well has been completed and all training and certification is finished, these same 6 individuals will be trained how to use a Berkey filtering system that will be placed in every home in all 3 villages. These 6 individuals will take a Berkey filter system to each home and train 2 family members how to properly use and store their new system. These same 2 family members will then be trained how to properly use the new community well system for accessing water. This is how we, as an intervention team, will solve the problem of accessing clean, reliable water year-round in 3 small villages and rural Nicaragua.
Nicaragua was the first program WaterAid launched in Latin America and the Caribbean, and in just 7 years, they have reached more than 19,500 people with clean water, 7,200 people with decent toilets, and more than 53,000 people with hygiene education. We are dedicated in helping the people in Nicaragua. We strive to not only get them clean water and to build wells, but to educate them on the wells and fixing them if they break down. We are working with WaterAid and reaching out to large companies to help us finance this project that we set out to help with many years to come. This is a project that requires a community to come together and help. We are joining forces with large companies to contribute and also contributions from individuals. We have several large companies that have already pledged to help us. Bear and LDS Charities are our top contributors. Building wells in Nicaragua is costly, and it is important that we have enough funds to make sure we provide the people with clean water for many years to come. The cost depends on a variety of economic, geographic, and cultural factors, many of which are out of our control. Some of those factors are the economy of the country where the well is being drilled and the cost of goods and labor there, how deep they drill before our rig reaches plentiful clean water. Those depths often range from 50 feet to 500 feet or more. The amount of rock we must drill through, which increase the amount of fuel and man hours required. Whether the well location is in a remote location, making transportation of the rig and materials difficult. In Nicaragua, it costs between $2,000 and $7,000 to drill a well. We are dedicated to raising enough money to pay for the upkeep for the wells, the cost for training, the cost that it's going to be for the drilling, the travel for the engineers and other volunteers, and also the cost for the water filters. On the Latter-day Charities website, it says, humanitarian efforts to relieve suffering for families of of all nationalities and religions and offer hope with potential for a better life for millions of people around the world. It also says that access to clean water improves health and family hygiene. The church assists communities to establish wells and other drinking water systems to provide access to clean water. The church also helps establish local water committees and provides hygiene training. The community donates labor and materials. Over 6.4 million people now have access to clean water because of this program. Another big company that is also contributing is Bayer. As part of the company's sustainability strategy, Bayer committed to expand access to everyday help for 100 million people in undeserved communities around the world by 2030. This donation is a key step in the company's plan to help enable health for all. Bayer is a global enterprise with core competencies in the life science fields of healthcare and nutrition. Its products and services are designed to benefit people by supporting efforts to overcome the major challenges presented by a growing and aging global population. At the same time, the group aims to increase its earning power and create value through innovation and growth. Bayer is committed to the principles of sustainable development, and for Bayer brand stands for trust, reliability, and quality throughout the world. We will continue to seek out large companies and individuals for contributions. We are so blessed to live in a country where we have clean drinking water that is accessible. One person can make a difference and save so many lives. If we continue to educate others and ourselves on this project and to give what we can, every little bit helps, and we are so excited to build relationships and to make a difference in these people's lives.
This section will focus on how we're addressing additional problems we'll face, and the first issue is to address political unrest. This requires good relations with government officials, and we'll achieve this by working through both embassies. This means connecting with and keeping both Ambassador Campbell and Ambassador Sullivan informed and involved. Our plan and efforts will be presented to the government of Nicaragua in a way that they know we are helping them. Shouldering a small portion of their burden in the form of providing improved access to clean water will not only help to raise awareness for the importance of clean water in the country, but also help in decreasing political unrest, as more citizens are provided access to clean water, which equals a higher quality of life. Keeping Ambassador Sullivan informed and updated on our intervention efforts will provide the U.S. Embassy with adequate information to keep any U.S. citizens, such as program planners and volunteers, safe while we conduct this project. Keeping Ambassador Campbell informed with our intervention plan and efforts will ensure that we are following necessary procedures and abiding by laws and policies that we may not otherwise be aware or informed of. Moving on, it's important to ensure that our intervention will be continuously maintained. Corey explained specific training pertaining to the well and Berkey water filters, and due to the lack of local community government structure, we won't place sole responsibility on the 6 certified individuals who receive training, at least not right away. The following are additional measures that will ensure intervention efforts aren't lost, which is what has happened to a previous attempt to install a shallow well for these 3 villages that doesn't provide long-lasting water. For the first 6 months after our intervention, monthly check-ins via communication technology, such as phone calls, video calls, and emails will be conducted to provide technical assistance and ensure things continue to run smoothly. Yearly visits for monitoring, observing, and inspecting will help us evaluate the results of the community, or the results of intervention efforts, how well the community is maintaining intervention efforts, and determine if changes need to be made, as well as means to provide funding for repairs. This will mostly be obtained through our partnership with Water for People, who we'll touch on later, who have a corporate office in Jinotega, Nicaragua, which is north of our 3 villages by about 2 hours. Also, due to the lack of local government structure, the first year after our intervention will involve 2 to 4 visits, after which 1 visit per year will be adequate. Partnerships and partnering with different organizations will allow us to raise awareness for this issue specifically in our 3 villages, but it also works towards prioritizing clean water initiative funding throughout the country as a whole. Although we plan to include different levels of government in our intervention, it is through humanitarian organizations that we will find success in addressing most of our problems. Our partners will be Latter-day Latter-day Saint Charities, WaterAid, and Water for People. These three organizations are already global partners. Each have conducted multiple clean water initiative projects in Nicaragua. It's important that we partner with them early and provide them with complete information of our intervention planning and efforts to gain their support by showing them that our intervention lines up with their mission and purpose. This will allow them to provide support addressing the problems we face, such as implementing our project in compliance with different levels of government, as well as providing assistance during unforeseeable future events. Latter-day Saint Charities, they stick out to us because of our ties with them and their purpose of providing relief, fostering self-reliance, and providing opportunities for service. Our intervention is based off their models for implementation. Water for People is who we'll look to primarily for evaluation of our intervention, but also support with training the locals. We'll also be using their hygiene education process or curriculum that they go through. Sorry, real quick. If you want, you can pause this page and read through the way that they generally conduct clean water initiatives. Next is WaterAid, who will look to assist in training locals to participate in the well's construction process. They also offer training for cheap and effective rainwater catch systems, as you can see in this picture right here, which will provide additional access to water. One of our problems is during the rainy season, villagers from 2 of the villages can be cut off from the well due to the overflowing river, which separates them from Paso Hondo, which is where the village the well is. Rainwater catch systems and the Berkey water filter that Corey explained will supplement each other to address this problem. Our intervention will also set a foundation for them to gain necessary data to implement better toilet and sanitation systems in the future, thus furthering the improvement of this community. As you can see here, some work they've done in Africa, a different area, but implementing a cheap but effective latrine. Moving on, to ensure that our efforts help villagers become more self-reliant, we will conduct water hygiene and disease training. This will be provided while digging and construction of the well is ongoing and after completion of the well when villagers begin using it. We will hold once-a-week trainings that cover disease and water hygiene. Each household is required to provide at least one participant who can attend and adequately teach their family or household members at each community gathering training. These trainings last approximately 30 to 60 minutes per session and include both education as well as activities to help the villagers retain and apply the information they receive. All training material is in compliance with WASH. However, our intervention won't address sanitization as of now. For diseases and disorders and health problems that are posed by contaminated water, community members will be given simple explanations of the disease or disorders and the issues they present to villagers' health. As you can see here, I'm sure you've read this already, but diarrhea is a big thing, as well as cholera, dysentery, typhoid and polio, and then waterborne diseases such as malaria or worm infections. But diarrhea alone is such a tremendous concern and problem, and it leaves children susceptible to contracting other diseases in and of itself. So to address this, this will be connected to things they can do to prevent disease and maintain good health, which brings us to this last slide of hand washing. Water hygiene education and activities will provide hand washing techniques using soap to prevent the spread of infectious agents and disease, knowledge of what water sources are safe to drink, practices such as boiling water, and other ways to ensure that water is safe. Proper handling and preparation of food using clean water will also be included in that.